Hi, Pine Forge Academy students. My name is Attorney Gwen Marie Davis Hicks, and I am a proud Pine Forge Academy graduate. I am from the class of 1998, and I know that sounds like a long time ago, but it just feels like yesterday. I used to be in school at Pine Forge and would remember when people would come to visit the campus there for their class reunions, just as I am coming to visit the campus tomorrow. And I would say, man, they're old. That's a long time ago. But you know what? Time flies when you're having fun. So what I'll tell you is you want to make sure that you do the most that you can with each and every day, because the clock is going to keep ticking one way or the other. The question you want to ask yourself is, what are you going to do with it? Well, since I graduated from Pine Forge Academy in 1998, I went to college and law school, passed the bar, became an attorney, worked for a judge, worked for a firm, and now I'm the managing partner at my firm, GDH Law. I am very proud to have started this firm and now have grown it to where we have about 11 employees within the firm. We serve clients in the Maryland, D.C., Virginia area. We also are licensed in different states across the country, including New York and New Jersey. With that said, what we do as an attorney, a law firm, is that we help people. There are clients all across who have different needs. We help business clients. We help clients who are injured, medical malpractice, different types of cases. But we're here to help people. And by helping people, we're able to fight hard for them in trial. There's different types of lawyers. I'm a trial attorney. So that means I have to go into the courtroom, put on cases for juries, and try a case. It's a lot of work, but it's very rewarding and it's fun. There's a lot of different things that you can do with a legal career. But what I will tell students is that you want to make sure that whatever you decide to do what you love. You do what you love and you do your best at it, you'll be happy. And happiness is really critical. You don't want to do something because, it can make a lot of money, or you think it sounds good. Do what you love. You do what you love, everything else will follow. I am so proud of you, students at Pine Forge Academy. The things that I hear you all doing is fantastic. Keep shining, keep being bright. The habits that you develop now in school are what is going to carry you for the rest of your life. So, do your homework, turn it in on time. If I'm late for a deadline, it's a problem. You can't miss deadlines. So, be on time for your assignments, get to school on time. I can't get to court late. Practice these habits now. And I am looking forward to the future because I know it's bright for each and every student at Pine Forge Academy. Take care.
Good day. I'm positively delighted to share these next 5 minutes with you, presenting another option for a career choice, as there are so many passions to fulfill in the lifetime God has in store for you. And you certainly do not need to know what you want to do for the rest of your life, not at 15 or 16 or 17 or 18. So this is just another career path to consider. That being said, let me introduce myself, then I will define the profession, tell you what you must know, share some of my experiences, and tell you how to get there. How's that? I'm Elizabeth, old-timers know me as Betty, Darby Watson. I'm a proud graduate of Pine Forge Academy, where I was prepared well for my life work. I'm a recent retiree from leaving the post of director of field education of the Bachelor of Social Work program at North Carolina A&T State University in Greensboro, North Carolina. Aggie pride. Okay, had to get that out of my system. At PFA, I was prepared well, and after graduation, I went to Columbia Union College, that's now Washington Adventist University, and I didn't know what I wanted to do. My roommate declared nursing as her major, so maybe I put that down too. After exploring math for a minute, I landed in psychology, finding that my interest, and that was the degree that I graduated. Even now, no one clamors for a psych major, so I knew I would have to go to graduate school. I was blessed to receive a full ride from Howard University, where I majored in psychiatric social work. It was such a rich experience. I graduated saying, "Wait a minute, world, here I come." So what is this field of social work? Like psychology is the study of individuals and sociology is the study of groups, social work is a practice-based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility, and respect for diversity are central to social work. And that's the official definition. So what does all that mean? Well, there are at least 320 job categories that social workers fulfill. In my brief time today, I certainly can't share them all. As a teacher for the past 30 years, it takes a whole semester just to introduce our students to the profession. In brief, however, I like to say we work from the womb to the tomb to empower individuals, families, groups, and communities through brokerage, mediation, facilitation, advocacy, crisis intervention, and the like. We work with children, the homeless, single parents, LGBT and other disenfranchised populations, in educational settings, in hospitals, in housing developments, in church settings, in the justice systems, and internationally. In addition to micro-level service, that means individual people, we work on the meso and macro levels, conducting research, writing policies, directing entire programs through supervision and administration. And social workers can make money, just in case you think we need to be poor all our lives. The lower paying jobs include working in arenas that serve children, as we don't value children nor people who work with them. On the higher end is program management and consultation. I've been blessed to consult with extended care facilities. Like 30 years ago, I was making $65 an hour. With the Center for International Relations using a Whirlpool grant, and we were being paid $500 a day. And also in corporate America and in insurance companies. And with them, I make about $300 an hour. Yes, there is money to be made. Plus, a caveat here is that whatever you make, determine to live within your means. Return a faithful tithe, give a generous offering, and God will abundantly bless the rest. So how did I get here? I mentioned completing college. Of course, do that first. You don't even need to major in social work, as you may earn a master's degree in social work in just 2 more years. If you major in social work on the college level, with a high enough GPA, you may qualify for the 1-year advanced standing MSW. Only in the academic setting is a doctoral degree necessary, as an MSW is considered the terminal degree in social work. Although it is commendable to have a job that you enjoy, that does not necessarily mean you will like every job out there. People are messy, and we get tired of them. The blessing with this degree is that you can change jobs without changing your profession. And many people work at least 7 different jobs during their working career. I've worked mostly in healthcare, but spent the last 30 years in academia. I have served in other capacities as well, including child protective services, mental health, and consultation. Okay, my time's about up. And I haven't told you any stories about this wonderful career path. So here's my contact information should you want to know more. Name, Dr. Elizabeth Watson. Phone number, 336-697-0853. And email, drmom35@hotmail.com. Now, whatever you decide, be determined to glorify God using your passion, education, gifts, and experiences to empower others while living in service to Him. Perhaps I'll hear from some of you soon. Be well, be blessed. Goodbye.
Hello, ladies and gentlemen. My name is Lieutenant James Alfred Johnson III, Pine Forge Academy, class of 1993. I'm here today really to talk to you for just a couple of minutes about what I do as a United States Navy chaplain. A part of my call to ministry, I believe, really started when I not only was a child, but especially during my time as a student at Pine Forge Academy during the 4 years I was there. God led me in so many directions, but ultimately to a clear call to ministry. I went to Oakwood College and I graduated with a theology degree, and I went to seminary and graduated with a Master of Divinity degree. And then I began pastoring. And as a matter of fact, pastoring is still something that I do also as a chaplain, but I pastor a church as well. And eventually, God led me to becoming a United States Navy chaplain. And one of the things that we do as chaplains is that we care for all, we facilitate various services for different faith groups that are there. We provide for needs of our sailors and our Coast Guards members, and also for our Marines. And I'll talk about that. And we also advise commanders. And one of the things that a lot of people may not know is that United States Navy chaplains serve not only the United States Navy, but also the United States Marines and the United States Coast Guard. And so as a United States Navy chaplain, you can serve in any one of those military areas, United States Navy, Coast Guard, or United States Marines. And being a United States Navy chaplain in the role that I am, I happen to be a United States Navy Reserve chaplain, which means that I still have a civilian career. So on the military side, I'm a chaplain. On the civilian side, I am still a church pastor. One of the things I love about doing it, especially this way as a reservist, is that I like to say it gives me the best of both worlds. I get to still do my civilian job, which I love, and I get a chance to serve on the military side as well. So if you are interested in becoming a United States Navy officer, particularly a chaplain, I would love to sit down and talk with you. So may God continue to bless you in your journey as you continue to discover what God would have for you to do, and most of all, what God would have for you to be. Get all you can while you are still at Pine Forge, but most of all, give all you have to God, because He has great and mighty and awesome plans for you. God bless you.
Hey Falcons, I'm Dr. Carmen Robinson, Pine Forge Academy class of 2000, and I am a family physician and chief medical officer for a community health center in North Carolina. I'm going to tell you about what I do. So after Pine Forge, I went to college and then medical school. After medical school, which is 4 years long, I did a 3-year family medicine residency. Family medicine is a primary care specialty, primary care being your first line of health. In family medicine, I can do just about everything. So I deliver babies, I take care of children, watch them grow up, I take care of their parents, I take care of pregnant women, I take care of grandparents, and then when people are at their end of life, I help them to transition peacefully. I also do procedures in clinic, very, very enjoyable. But in addition to being a clinician, I'm also an administrator. As I mentioned, I serve as Chief Medical Officer. Chief Medical Officer is part of what's called a C-suite or a chief suite. I work alongside our Chief Executive Officer, our Chief Operations Officer, and our Chief Financial Officer to oversee the organization. my role is clinical. So the persons that report to me are members of the Quality Improvement Department, Behavioral Health Department, our Nursing Department, and I ensure that all of those clinical aspects of the organization are working seamlessly so that we provide best practice, evidence-based medicine, and provide quality clinical care to our community. Part of what I really, really enjoy about my job, working in a community health center is unique. It's different from working for a big corporate healthcare institution or even private practice. What I do in a community health center as a clinician and as an administrator, I get to effect change in low-income, historically marginalized communities. As a Black woman, I know that my people traditionally suffer more from chronic diseases, diabetes, high blood pressure, kidney failure, cancers. And what I enjoy doing is reaching those communities, helping people take responsibility for their health, giving them good health strategies, and making sure that they are not succumbing to these preventable diseases. I love it so much. I'm so grateful for what I do. If you're interested in medicine, give me a shout out. I like to consider myself the HFIC, the head falcon in charge, because of my administrative role. I give thanks to God for the foundation that was set both in my family and in my home, but also at Pine Forge. It helped instill in me the discipline, the leadership skills, and the academic foundation needed to be successful where I am now. So I look to see you sitting in the seat one day. Y'all take care. Bye.